celebrate Christmas. Again, I'm Al Richmond, Executive Director of Community Campus Partnerships for Health. I'm based in Raleigh or Research Triangle Park, North Carolina. And it's my pleasure to have you today as participants in our information session around this new funding opportunity. This is our first information session, and so we're going to learn a lot from you, and we hope that you will provide us with some feedback. I think it would be really neat to have you quickly to introduce yourself. That way we'll know who's on the phone. And let's just do that. So I'll just pass it quickly. If you just tell us your name and if you represent an organization, and that way we can capture that information as well. I'll start with Anita Holmes.
Good morning, everyone. I'm Anita Holmes, as Al mentioned, and I'm a consultant with CCPH. Thank you.
Thank you. Janelle Henry.
Good morning, everybody. My name is Janelle Henry. I'm a program assistant with CCPH, and thank y'all for joining us.
Thank you. Thank you, Janelle. I want to acknowledge Janelle for organizing and pulling everything together, and Anita Holmes and Adina Black as well for their support for today's webinar. I see Dr. Dawn Baldwin Gibson on the call.
Good morning. I'm Dawn Baldwin Gibson with Peloton Ministries. We're housed in New Bern, serving 6 counties in Eastern North Carolina. Glad to be with you this morning.
Thank you. Thank you. LaTanya Brown.
Yes, good morning, everyone. I'm LaTanya Brown, and I'm here on behalf of Coastal Horizons. We are located throughout North Carolina. However, I am based in the Columbus County and Bladen County areas, with our main office being in Wilmington, North Carolina. I'm just glad to be here this morning.
Thank you. We're glad to have you. Dr. Tony Barr.
Good morning, all. My name is Tony Barr. I'm Executive Secretary Treasurer with the General Baptist State Convention of North Carolina. Our headquarters is in Raleigh, North Carolina, and our churches are throughout the state, and glad to be here today. Thank you.
Thank you. Swan Davis.
Good morning, good morning, good morning. I am Swan Davis, president and founder of a nonprofit organization called Let's Make It Happen Together Incorporated. We are in Cumberland County, but we do work throughout the states, the communities in North Carolina.
Swan, I have to acknowledge that you're the first person I've ever met named Swan. What a unique and great name. I love that name.
I appreciate it. Thank you so much. Thank you.
Oh man, that's unique. There's only one.
That's it.
Lakina Cooper. I just mispronounced your name. Please correct me.
You were close. It's Lakia Cooper.
Thank you.
And good morning. And I am with Dr. Tony Barr. I serve as the Director of Missions and Program Engagement for the General Baptist State Convention of North Carolina. And I'm excited to be with you this morning.
Thank you for joining us. I see Mount Carmel Helps on the call. Mount Carmel? Okay, we'll come back to you. I see Barbara Lee. Barbara, would you just introduce yourself? Oh, Mount Carmel, go ahead. Okay, Barbara Lee, would you introduce yourself and tell us who you're with? Okay, all right. Well, maybe we'll hear from Barbara and Mount Carmel at some point in time. So again, I want to welcome you to our information session. I hope that we can get everything in the next 55, 52 minutes. We'll do our best and we'll move forward. Next slide. So in terms of our agenda today we've had some introductions. We want to provide an overview of the project, quickly go through the mini grant application, and then answer at different points in time any questions that you may have and respond to those. I will acknowledge if we don't have the answer today, we are curating a list of questions and we will provide a FAQ, frequently asked questions document that we'll make available to you. I just want to just say thank you for not just only joining us today, but being willing to tackle this particular opportunity during the holidays. We realize that it's a crunch, and we're asking a lot of you. Thank you for being willing and being interested in this opportunity. We decided, our team made a decision to proceed with the award because of the time sensitivity of the content as a response to COVID-19 and the annual flu season. And so we decided to move forward when we were notified, when we received the grant, and when we were able to kind of get everything in place. So thank you again for your willingness to consider this opportunity. Next slide. And I'll provide a project overview about the National Network to Innovate for COVID and Adult Vaccine Equity. This is called NNICE. This is part of a larger national initiative. Some of you joined us for our first call, and so you heard more about this. We won't spend as much time talking about the national network, but focus primarily on the application itself. Next slide. So again, we're with Community Campus Partnerships for Health. We are a national organization that's based in North Carolina. We are one of the sites for the NNICE project. It's part of an initiative funded by the Centers for Disease Control and Prevention to really increase access and availability of adult immunizations and different populations. We have decided here in North Carolina to focus on African Americans living in Eastern North Carolina, in part because of the current trends in COVID-19 incidents and associated vaccine uptake. Next slide. These are the counties that we have that historically comprise Eastern North Carolina. So we're primarily talking about those counties, what we say east of Interstate 95, though some of them may be on the border of Interstate 95. And so I hope we captured everyone. Does anyone not see their community here or a community that they serve? So I've heard from some of you from Columbus and Bladen, New Hanover County. Some of you work statewide. So I think that most of your counties, when you introduce yourself, are part of this list. Well, I'll just keep moving for sake of time. But again, this is a pretty significant number of about probably 25 to 30 counties, again, that comprise Eastern North Carolina. Next slide. So want to just provide, again, an overview in terms of just a succinct snapshot of this funding opportunity. Again, it will focus on increased awareness, availability, access, and confidence in COVID-19 and influenza vaccination. This is a two-tiered mini grant program. Tier 1, now we're using these terms Tier 1 and Tier 2. Some of you who are familiar with kind of the Council of Governments and Rural Center definitions of Tier 1 and Tier 2 counties, this does not apply. We're just saying Tier 1, Tier 2 in terms of the amount of money. Tier 1, you can pursue funding at $50,000. We think of these as probably more large scale organizations and projects serving multiple counties, not just one community, but multiple counties. And then we have our smaller tier or Tier 2, which is $10,000 for smaller scaled organizations. We felt that this would give everyone an opportunity to participate. Some people say, some of you may decide you want to focus in on just one community, Pine Tops or Goldsboro or a specific city, Princeville. You can do that. And you may say, we just need $10,000 to support some of the activities that we're doing in a specific community. Others may say we serve a larger group, we're multi-county or we're statewide with a focus on Eastern North Carolina. So you may say we want to pursue a larger pot of money, the $50K. And the budget should reflect that. So I'll talk more about the budget, but the budget should match that, right? So if you're pursuing the Tier 1, The work should be multi-county, and it should reflect a scope of work that is consistent with that. And then we'll also talk about, you should focus on what we call one or more promising practices, and I'll talk about promising practices. Next slide. So the key dates, the application will open on Monday, and it will be all online, and you can submit your application there starting Monday. The application deadline currently is January 7th at 11:59 p.m. Eastern Standard Time. I'm laughing because we have staff that work in California or on the West Coast. And so we have to respond to applications all the time, and they're very clear about which time zone, which is typically Eastern Standard Time. So we want to be clear about that. Yeah. So the award announcement is out. The award announcement will be made on January 24th. And then we anticipate the start date being February 1. It's a short, quick sprint to the finish line, because we need to roll these projects out and be responsive, again, as we are all familiar with about the Omicron variant, and just, the fact that we continue to wrestle with COVID-19. Next slide. So in terms of intervention categories, there are 4 levels at which you can select. You can select at least one. You see at the bottom it says select, must address 3 of the 4 categories. We're saying at least one. So you can work on multiple levels, and most of you are thinking about working on just that. There's the environmental level, and that includes interventions addressing social and cultural norms on health, economic, educational, and social conditions related to immunizations. On the second level, the community and clinical level, interventions addressing settings in which social relationships occur, such as schools or a neighborhood or settings where healthcare is provided. So you can work on that community level. You can work inside of a church or a cluster of churches or in a community or neighborhood. There's the interpersonal level that you can work on in terms of interventions addressing social and personal relationships with neighbors, colleagues, healthcare providers, and friends, or you can work on the individual level. Now, probably, I'm assuming that many of you are thinking about working on multiple levels, but at least you will be required to pick at least one of those intervention categories: environmental, community and clinical, interpersonal, or individual. Check at least one, pick one. Next slide. In terms of the guidelines, again, this is focused on African Americans within Eastern North Carolina. The organizations can be state, local, and or community organizations, but you should be working at the community level and within a defined community. Again, working at picking at least one of these areas in terms of environmental, community and clinical, interpersonal, and individual. We will talk some about promising practices that many of you are familiar with, and then agree to meet the reporting requirements that we will detail in the memorandum of understanding that we have with you as an organization. Next slide. In terms of the application itself, this is a pretty standard application if you have that you're familiar with. We may adjust some of the word count, so you'll see that on the actual application. So there you will be limited on your application by a word count, and we will set the system up wherein it will just stop at that word count. Now, what I suggest that you do, just in terms of technical assistance that I do, is to actually write it out or type it out in a Word document, and then convert it over into the application template. And that way, there's a word count feature in Word. So familiarize yourself with that. This will help you to be very clear, to be very concise, to be very focused in your response. Just you need to focus your response. You know, I'll talk more about what makes a good application, but it's being able to paint a really clear and concise picture of what you propose to do and who you are and all of that. So just be very clear. Describe your organization. We want to know what your mission, your brief history, and your structure is. It's a nonprofit based in, you know, Xavier County. You've been in operation for 10 years, 5 years, 3 years, or you stood the organization and the work up in response to COVID-19. You serve X number of counties or community. Describe your organization, be clear and concise. Then focus on project need. Why does your community need this? We'll provide you with some data sets and you will say, we need this because, you know, Xavier County has the highest incidence of COVID-19 cases in the state of North Carolina, or we have the largest unvaccinated population of individuals for the flu or for COVID-19. Then you will select a type of intervention, a promising practice. You will provide a project summary. And so there'll be a maximum word count that you will see in the template itself. Provide a summary. This is the summary that will go on the website. This is a summation of your work, description, and then overall impact. What do you plan to do? Briefly describe the likelihood for your project to provide a sustained influence to increase awareness of, availability of, access to, and confidence in COVID-19 and influenza vaccination. Our overall impact is to fill in the blank. Be very clear. We want to increase awareness of, we want to increase access to, we want to increase confidence in COVID-19. And the way we will do that will be through, we will provide X number of educational sessions or one-on-one contacts, or we will recruit X number of churches and those churches will do this or that. So be very clear, kind of think about the continuum of the work that you propose to do from ideation. Here's the idea that you have to work on this project. What are you going to do and how are you going to do it? Describe that, paint that real clear picture of what it is that you plan to do, how you plan to do it, and then how you plan to kind of what impact you propose to have. Do you plan to increase by a certain percentage of people or have a certain number of people participating in some type of clinical event in your community? You plan to sponsor 6 pop-up clinic immunization events in your community. So describe that. So I'm just trying to give you some sense of the breadth of ideas that we're looking for. You know what you plan to do. You just have to describe it, and you have to describe it in such a way that we understand it. What I would encourage you to do is to start early with your description and your application. And that way you can have someone to kind of read it and make sure that it's clear and concise. Again, we think we know, we have a good sense ourselves, I do, of my ideas, but when I talk them over to other people, then they start asking me questions. So I won't go too far in detail there, but I just wanted to, we want to fund people, but we want you to have a good application and a competitive application, I should say. Next slide. So then you'll talk about your approach. What are your objectives? What's the significance? Why do you think this is going to work? It's going to work because we've done this before and we've had some success in this area. We did this during the pandemic and we know that this approach work, and this approach works because people in our community work from 8 to 5. And so therefore we propose an evening clinic or immunization event or a weekend event, or we're going to immunize people after church or on Saturdays or at the Walmart. Describe the approach, then describe some of your best past project successes. What have you done during COVID-19 in response to the pandemic? What have you done? So describe that work. Some of it may be connected to COVID-19 and flu and adult health. Some of it may not, but go ahead and put that there. Then certainly your budget justification, which will give us a written narrative, of how you propose to spend the money, a timeline, and then the evaluation. How will you determine and document project success? Next slide. So I'm going to go now in talking a little bit about picking a promising practice, but I'm going to just want to stop just a minute to see if there are any questions or comments in the chat box. Any questions quickly? You can go off mic. You can unmute yourself and I can answer those questions. Anything stand out? I can't see if anyone's talking. No questions? Okay. All right. We'll have another opportunity. So get your questions ready. Let me see if anything's in the chat box. Okay. All right. So step one, pick a promising practice. So we have listed here some promising practices. There's more information about this. We'll make that available to you. These are, yes, I heard a voice. Go ahead. Does someone have a question? Okay. So in terms of promising practices, these are examples. We're going to go into detail a little bit on this, but you can sponsor, you should pick one of these or multiple of these that you want to work on. You know, what level you want to, so you'll have a level that you're working at, and then you'll have a promising practice. Your promising practice could be a community-based vaccine distribution site. That's what you're going to do. You're going to sponsor 5, 10, 15, 20 of those events. And you're going to, you're going to market that event in your community or across different counties. You can have a community level immunization champion. These are individuals, organizations, groups that will be champions, community specific or subgroup specific public health education campaign. You're going to work in partnership with the health department or a healthcare system. You can have electronic health records data, record vaccine reminders, a mass public health education campaign, describe that campaign, a medical system immunization champion, patient vaccine navigator, and the social media diffusion of knowledge. So you can pick one of these promising practices, and these promising practices are called promising practices because they've been proven to be effective when it comes to adult immunizations. So rather than kind of thinking about something, on your own, we're providing some guidance to you so that you can look at the promising practices. Next slide. So I'm going to quickly kind of go through some of these in terms of what would a community-based vaccine distribution site event look like. The description is that you're increasing vaccine access through broader and non-traditional community-based distribution sites at a church, at a Walmart, at a center, at a community center, at a Masonic lodge, at the Elks Lodge, at a corner store, at a park, in a community. That is a non-traditional community-based distribution site. So be innovative. Think about the communities that you serve. Where do people gather? Where can you have some impact for a distribution event? And then, and that includes occurring after regular hours, including non-traditional settings. We already talked about that. You're going to provide people with maybe some child-related services so that they can participate without being concerned about the safety and the care of their children. And then you're going to apply this to the community. Again, you're going to identify locations that are community visited by unvaccinated adults in your community and focus on these locations. You know the community, you know your community. So just think about what will work there. Next slide. We want you to show innovation. On a community level, immunization champion is an individual situated within the community who facilitates the interactive process between knowledge and the intended users of the knowledge, individuals who are unvaccinated. These are kind of like your champions. These are individuals out there who are maybe who went door to door, who are going door to door. These may be lay health leaders, community health workers, pastors, presidents of organizations, block captains, community neighborhood leaders. This may be a church mother, church mothers. This may be, you may be part of a religious community, a denomination where you have a ministry, a ministerial alliance, or missionary society. So you think about, again, your community and where you propose to work, and you can actually train these individuals, and we can work with you in training them. Next slide. This is community specific or subgroup specific public health education champions, sharing adult vaccine information through community specific methods. Again, door drops, or, you know, putting what we call door knockers or door drops on people's front door. You can sponsor webinars where you have people ask the experts. You can work with physicians in your community. You can have webinars in your local community. On the radio, local AM, FM radio station. Again, this is about innovation, 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 innovation. Reaching people who have said, I do not want to be vaccinated. Reaching people who, you know, aren't getting accurate information, where disinformation is just permeates a community. So think about that, about those groups, about those sites, you know, about where those people would be. How do you reach those individuals with information? Next slide. You're going to tell us what would work in your community. You can also use electronic health records. If you're part of a healthcare system or partnering with the healthcare system to remind people to receive the flu vaccine or COVID if they have not yet. Next slide. Mass media campaign where you develop specific marketing material, billboards, television, radio, messaging that you can use. Excuse me. So again, we want you to think about your community and what will work best. Just as an example, if you're in the Elizabeth City region, you might want to partner with Elizabeth City State University radio station. Or if you're in the Fayetteville area, you might want to partner with Fayetteville State University radio. Again, thinking about how do you reach people in your community? Next slide. Medical system immunization champions. These are physicians, providers, clinicians, nurses, other people in your community who you can work alongside of. This might be kind of a blended model, including people in your congregation, if you're a faith-based initiative, or even in the community who you mobilize, physicians, African-American physicians, nurses, healthcare providers, who can become champions around adult immunization. Next slide. A patient vaccine navigator. This might be someone who's telling their story about how they survived COVID-19 or about the flu vaccine. So these could be navigators who kind of tell the story, but help people to kind of walk through the process as well, and removing any of the logistical issues that are associated with being vaccinated, including I'll go with you. Right? You could have a buddy up campaign where people say, if you're afraid, I'll go with you to be vaccinated. I'll even hold your hand. I'll go with you. Next slide. And then again, social media diffusion of knowledge, using social media platforms. Again, you know your community. We talk about this new term of social influencers. These are people, you may be the person in your community that has a really large Facebook following, or YouTube, or WhatsApp, or Instagram, TikTok, Snapchat, all those platforms, LinkedIn, that you actually use those to really provide accurate, up-to-date, current information. a lot of this is around dispelling misinformation. So providing accurate information to people using social media. And this would allow you to have a large imprint. A footprint. You may have a website already that you actually modify your website and your social media to really have deeper contact with the community to reach a larger audience. Next slide. So I want to stop here with questions. If we could just kind of stop sharing the slides for just a moment. I know you have questions, so I want to give way to that. Again, I want to welcome those who joined the call. Any questions coming from you so far? What are you thinking? Questions? Points of clarification?
Hello, Mr. Richmond. I put my question in the chat box, but I was wondering, is it going to be a match requirement on the funds?
No match.
Okay.
Thank
And
you.
what are we looking at in regards to having to maybe, is this going to be a one-time grant opportunity? Or is it going to be something that's sustainable, or what is the future on that part?
Great question, LaTanya. So first of all, again, there is no match requirement. This is time limited through, I believe, June of next year. We anticipate that we will receive additional funding. We've not made a decision. That decision has not been made. We're not clear as to whether or not we would ask individuals to reapply, or we would just continue those projects that were part of what we say, maybe say phase one. But again, it would probably depend on it. I know it will depend on, will the funds be renewed and how much of those funds are available.
Okay, thank you.
You're asking, can you purchase food for an event? Yes. You just have to document it and make sure that it's clear how, what the purpose of it is. I will say is with all funding, be reasonable. Any other questions? Barbara, I want to just clarify that that end date. I'll make sure I clarify that. Barbara's asking, so the grant cycle is February 2022 through July 2022. Yes, I would say 2022, not 2023. This is just about a 6-month project. Somewhere a little bit about 5 to 6 months.
So, Mr. Richmond.
Yes.
This is Swan Davis. So in your large one that we're proposing to go after, how many events we're looking at between, I think you said the grant will be available around February 1st, correct? That's awarded.
Yeah.
So from February to June, how many events are being asked to have during that time?
Yeah, Swan, that's a great question. I don't have a specific number. I think that you would have to provide us with some justification if you were proposing to do one event versus maybe one each month. So again, we would look to you to decide that. How many events you plan to do. I don't want to give that away and say 1 or 2 or 3. If you're serving kind of multiple counties, you may do one event in each of those counties. You may be serving 4 counties. What's reasonable for you? And then I think that you would also want to think about what's a blended approach wherein you're doing some community events or what we now call pop-up screening events or testing events, immunization events. Immunization events. And so what would be reasonable? What may be reasonable in one community may not be reasonable in another community, thinking about proximity. So we would be interested in your making the case that, some communities in rural North Carolina, you may have to have 3 or 4 in order to, just so that people are not traveling a long distance to get to an event. But you, again, your community, and would have to kind of share that with us.
Thank you.
That's as vague as I can be. Any other questions? All right, let's go back to the resume the slide deck, and then we can take it from there.
Mount Carmel helps. Did you have a question? I see you
Yeah.
off mute. And if you're having trouble with the mic, you can always put it in the chat.
Yeah. Okay. All right. This is not our last time. Next slide. And so we want to talk some now about approach. That's very straightforward. Again, next slide, is to think about what are your objectives? What's the significance? Again, why are you doing it this way? Why is it important? Why is it innovative? And what are your strategies? What do you, be very clear about your strategies. A pop-up event, information session or sessions, describe that and be very clear about this. When I think about, I keep coming back to innovation. I think about, can you work with, where people gather. I mean, I've been out and I think about driving from Raleigh to Ahoskie, and I think about where do people gather between Raleigh and Ahoskie other than say Rocky Mount, but what are those places? What are those venues that are in communities? I see Masonic lodges. I see even gas stations. Could you have a pop-up event at a gas station? Is that where people gather? Where do people gather? So thinking about that and we're looking for innovation. We're looking for you to tell us how you're going to reach people who otherwise may not participate in an immunization event because it's not convenient for them. Next slide. And step 3 is to develop a budget. I've talked some already about the budget, and we'll go in a little bit of detail here. Again, it's anticipated project costs. Be clear about what you think you're going to need. Sit down and work that budget out. The budget items need to be clearly connected to the aims or objectives of the proposal. Consider all of your costs. And then be prepared to write a detailed narrative justification for all the cost. Why is this item in the budget? Why is this item in the budget? If you're going to spend money, tell us why you believe you can justify those costs. Next slide. And I just want to say around budget and all items that if you have questions, just ask us at any point in time. We'll give you an email and we'll respond back to you. Allowable costs it's permitted at a cost within general federal regulations, and then non-allowable are those costs that cannot be reasonably allocated to the project. So just think about that in terms of what's practical, what's reasonable to do the work that you do. So if you were earlier question around food cost, if you think you need food for an event, that would be a draw. You want to provide sandwiches or snacks or bottled water, things like that. That's reasonable and allowable. Next slide. As long as it's not excessive. So certainly the typical direct cost are personnel. Who are the people that are going to do the work? We're not expecting you to use all volunteers. What are the salaries? And it may be small stipends that you may offer to individuals as part of this project. If there's a fringe benefit, if there are personnel, non-personnel costs may include equipment, supplies, travel, other subcontractors or other direct costs that are associated with your project. Next slide. The allowable costs are food for community discussions and information sessions. That's one way to get people to an event. It's food. And so software, communications, teleconferencing. You may need a hotspot. Yeah, I think we're going to remove space rental. You may need space rental, but be careful there. And renovations, I would actually exclude that one. So just we'll exclude that one. We're not expecting you to build a building or renovate a building. And then under not allowable, donations, personal expenses, fundraising, indirect costs, you know, any project, any cost that, you know, we're not, you should not be paying people to complete the reports or anything like that other than personnel. You may use, you may have other costs under communications, such as graphic artists to design slides or to design communication messaging flyers for you. That's allowable, but be very specific. Next slide. Again, any questions about the budget? You can go off mute. I'll check the chat box. Any questions about the budget? We can come back to that. Okay, and we have a couple more slides. Equipment should not exceed 5,000. Of course, if you're on one of the smaller grants of 10,000, you know, what's reasonable based on the fact that you received $10,000. And so just think about that. So it needs to be reasonable. And then supplies cannot exceed, you know, their supplies are anything less than $5,000. So this is the difference between supplies and equipment. Next slide. We are allowing mileage. So as part of your project, you may say, you know, you need to be reimbursed for your mileage with the carrying out services and activities. So the current rate is 56 cents per mile. That may change in 2022. But you must adhere to the standard IRS mileage rates that are in place. Again, the current rate is 56 cents per mile. Next slide. You can utilize consultants. These are individuals who usually charge per hour. Again, that needs to be a reasonable rate. And it should be explained in a letter of support. And there you may have vendor services that may be that you may be working in partnership with another organization, and you say that you're going to also provide some funding for them as well. Next slide. Any questions regarding the budget or budget justification or issues there?
Oh, yes, this is Tony Barr. I have one question. In offsetting existing staff, so existing staff is carrying out this outside of their normal duties, but to fulfill this project, but we can offset staffing costs based upon the percentage of time that they spend working on this project. Is that correct?
That is correct, Dr. Barr. So in that example, you may have an employee that is working 40 hours a week, and you can say that this individual will devote 10 hours per week on the vaccine equity project. You would actually just take their annual salary and kind of analyze that and actually indicate the amount of compensation that will be provided to that employee through this particular project. That is allowable.
All right, thank you.
And Barbara's asking, will this detail from the slides be included in a packet for grantees? Yes, we'll make sure that you get the slides, but we'll also, I think we need to clean the slides up a little bit. We'll work on that and get those back to you, Barbara. With additional, we'll try to also develop, we will develop the FAQ, frequently asked questions, and share those with you as well. Next slide.
I had a question, Mr. Richmond.
Sure.
Right quick, Is it the expectation that any of the funds will be used to actually purchase any vaccines?
I don't have the answer for that. I mean, as I was going through the budget, I was thinking the same thing. Is this LaTanya?
It is. I'm sorry. Yeah, LaTanya. Mhm.
Yeah, actually, I recognize your voice, but I think I will need to clarify that
Okay.
question with the funder, but it seems reasonable. But let me check on that. I guess I paused on that one because the vaccines for the most part have been made available for free. And so I think that this project we want to focus more on facilitating getting people to a free vaccine site as opposed to using these funds to purchase vaccines. One of the groups, for example, that's excluded from participating are health departments and healthcare systems, because in part they have received funding to underwrite the cost of providing free vaccines to individuals. But I will clarify that, and we will get back to you. But thank you for that.
All right. Sounds good. Thank you.
No, that's good. Thank you. So I want to just give you a few quick takeaways. I've already kind of alluded to these, and be clear on the interventions. Every expense must be allowable. Each expense needs to be related back to a specific task on the project, including personnel effort. Basically, if you've ever done, if you've been a part of a review team that's looked at funding proposals, what people do is typically take the proposal and they take the budget and they put them together, and they're looking at how those two are aligned. So your budget and your program proposal need to align. People will introduce a cost in the budget, and you're thinking, and the reviewer saying, where did that come from? Say, well, we're going to rent a van, and we're going to have the van to go around all over the community and provide free vaccinations. And you, at no point in the narrative did you say that you were going to do that. So there's misalignment. So the way I think about it is reading back through it and making sure it's aligned in such a way that it's not going to trigger a question or some confusion. So align those two up together. Take your budget, take your narrative, and make sure they are aligned. If you say you're going to do something in the narrative, then make sure the budget says just that. Now, you can say some of our costs may be in kind. Denote that. So make sure that you're clear about where that cost, how you're going to pay for that. Pay attention to the award limits at 10,000 or 50K. Provide detailed justification for all direct costs by describing how you estimated that cost. How did you come to that cost? How did you get to that number? Just tell us how you got to that number. What was the source of that? Or you're going to use the IRS standard rate for travel to get to that. So be clear about how you got to that number, right? Just be very clear. And is there another takeaway? I think those are all of the takeaways, but yeah, be clear, concise, and thorough. Just be clear, concise, and thorough. I mean, can't say it enough. Next, and tell us how great you are. Yes, tell us how great you are. You know how great you are. You need to tell us that. And remember, I should say this, that the reviewers are going to be, they have to sign a conflict of interest that they have no conflict relationship to you as an organization or individual, or they have to recuse themselves. So they don't know how great you are. They don't know all the things that you've done. And they don't know how wonderful you are. So you're kind of, I think of a proposal as writing a story. So you're writing a story, you're telling people the work that you're going to do, how great you are. And so do that. Don't take anything for granted. Next slide. So the information around the Vaccine Hub, this is a great site to use, www.vaccineresourcehub.org. Look there, and there are other resources that we'll make available to you. Next slide. And again, these are other resources that we can make available to you, and we will make available to you. I think that's the end, and I'd like to just kind of open it up for Q&A. You have our email addresses, al.richmond@ccphealth.org and NNICE@ccphealth.org. If we could just go back, stop sharing the slides, and have you to, again, ask us any questions. So a question I see, I'm not sure if I missed this in the budget. Can incentives such as gift cards for vaccine participants are they allowable? I will need to clarify that, Dr. Gibson, about that. There's a little controversy around the use of gift cards. And so I just want to clarify that. I think that I would encourage you not to use a significant portion of your dollars to provide incentives for individuals to receive a COVID-19 or a flu vaccine. What you may want to do is to actually kind of have incentivize people wherein maybe people have a raffle or something like that, or a select number of people that will receive an incentive, as opposed to offering incentives for each individual. There's some questions regarding just kind of how ethical that is, and again, using your dollars for that purpose. Any other questions? These are great questions, and you challenged us to think about and go back and clarify. Are there other questions? Please send them to us. We're doing a webinar tomorrow. If you know other individuals who in your communities, excuse me, that would be interested in this particular funding opportunity, please share this with them, and please send us questions. I'm taking some time off, but I'll be available to respond to your questions, and we'll get a response back to you as soon as possible. Thank you. Again, any closing questions, or Anita, Janelle?
No, I don't have any other comments. We will get the slides back. And anyone that's just joining us, joined late, I have asked if you'll put your name and organization in the chat box, and I think most people have done that. Thank you.
I would say in closing, thank you, Anita, that keep it simple, straightforward. If you've been doing some work during the past 2 years in your community, use these funds to grow out what you've been doing. Think about the best practices and what's worked in your community. Think about, I just keep coming back to, your community, your audience. You're on this call because you are community leaders. Describe what you've done or what you propose to do in a very clear, concise manner, and then align the narrative with the budget. And that would, I think, would generate a competitive proposal that the reviewers can look at. Our goal is to support you. That's what the funds are for, not to exclude you. So be competitive and happy writing during the holidays. And again, if you have any questions, please follow up with us. Janelle, any closing comments or?
Yes, I would like to remind everybody, I put it in the chat, but the application, FAQs, a recording of the info session, as well as resources will be available on our website. And I'll send out an email to everybody on Monday as a reminder, including the key dates for the application process. But if you have any questions, please email NNICE@ccphealth.org.
Yeah.
Thanks, Al.
Thank you, Janelle. And what I would say is think about what you want to do, write it out, just write it out, write it out. Don't hit send, don't hit send, because don't do that. So just keep writing it out, developing the narrative and the budget. And if you have any questions, ask us before you hit the send and before you download it, put it in the template and send it to us. So just think about that. All right. Thank you so very much, everyone. Yes.
Now, I would like to mention, I think some people joined late and may not have heard which counties are included.
Yeah.
It is Eastern North Carolina to the east of I-95, but you don't, if you serve those counties, you can still participate even if you aren't based there. But if you aren't able to participate because of that, please share information with groups in Eastern North Carolina that you think might benefit. Thanks, Al.
Right. Thank you. Happy holidays, everyone. Merry Christmas to you. Be safe. Take care of yourselves. And we look forward to seeing your applications. Bye-bye.
Thank you. Bye-bye.